Good afternoon,
Good
sir.
afternoon.
Yes, we know who you are, but please, for the people watching, can you introduce yourself to us?
Sure. My name is Dr. Kelechi Ohiri. I'm the Director General of the National Health Insurance Authority.
Okay, perfect. And can you brief us on what's happening here today, what this event is about?
So I think what's happening here, there are many ways to look at it. I mean, fundamentally, it's about launching Diaspora Health Insurance and launching an app. But in reality, what is it really doing? It's attempting to create a bridge and reduce information asymmetry and also make it easier for people who historically have been looking for ways to engage in Nigeria or lack a credible platform to do so, right? And that's why the app is sort of a vetted, one-stop shop for people to have access to credible, vetted providers. For insurance, what it means is that it's an opportunity. Most people send money to their loved ones when they are sick. A lot of people, you hear someone is in hospital and you want to help them. But is there a better way to provide healthcare than wait for people to fall sick at that moment in time? Because what if that money doesn't go on time? So what they're trying to do is, in every country they've been in, they've seen how insurance helps. Health insurance helps people because you pull your risk, you pull your resources.
Yes.
And Nigeria also has health insurance. So they're saying, okay, it's an opportunity for you to pay for your loved ones to be covered throughout the year. And then it's not only when they're sick, but they can even just go for a checkup, right? And most people that are covered are the vulnerable ones, right? So it's also a way of ensuring that the poor and vulnerable are covered because somebody is willing to pay the premium for them, usually someone from the diaspora. So that's what this is about.
Okay, so who is this for? Who would it benefit more?
Oh, everybody can benefit from it, but I think the people that benefit mostly are those that tend to be more vulnerable and poorer, the elderly, for instance. When I lived in diaspora, when my dad was sick, I would send money, right? And many people do that for their relatives, for their brothers, etc. So it's always people who ordinarily would not afford it that you're now providing a way of accessing care to them. So those are the people that will likely benefit from it.
Okay, so perfect. So how have you collaborated with the ADC for this whole system?
Well, when they reached out, I made it clear that a few things have to, one is you should use existing platforms. Let's not start recreating systems. We regulate HMOs in Nigeria. We see their plans. And if they partner with existing health insurance, whether it's public or private, at least they have an assurance that you're working with those who are already regulated. So they consulted with us. They told us what they were doing. We advised them.
Yes.
We shared with them our operational guidelines, how we work with HMOs, how we work with state health insurance entities, the type of benefit package that is covered. And so that guided them to, I guess, get to the point where they decided, let's not go and create something. Let's work with those who are actually doing things in Nigeria.
So basically, it's like a bridge with diasporans.
I think it's a bridge between diasporas to
their relations in Nigeria,
and their relatives in Nigeria.
So can you give a message to diasporans about this whole system? Do you have a message to tell them something? So since they're not here, we are the one that have witnessed it. So
sure.
Can you tell them something?
So I'll tell diasporans that it's important to stay engaged in Nigeria. And as far as health insurance is concerned, it's a better way to pay for healthcare than paying out of pocket. And this Diaspora Health Insurance program, it's really just connecting you to health insurance providers in Nigeria. And it's a very useful way you can actually connect and ensure that the people you're working with to cater for your loved ones are those who are already accredited and approved and properly regulated by the Nigerian authorities. So similar to what obtains in the different countries we're from, we have an opportunity here.
So thank you so much for your time.